Madam Chair, thank you so much, and let me thank all of the members for being here today. From the fullness of this room, it's very clear that your topic today is of pressing and urgent public concern. And I will assure you that the experience of our task force on lowering drug prices reflects the urgency and the interests of this committee hearing. Our group is bipartisan, 2 Democrats, 2 Republicans, 2 House members, 2 senators. We cannot afford to allow this critical issue to lapse into some sort of political football because people's lives are literally on the line. We are urban, we are suburban, we are greater Minnesota. We have a great diversity in terms of background and experience. Some of our members are people who use medications like that they depend upon to save their lives. Others are people who work in the industry. We have people from government, private sector, and we always have an ample number of people who use the time that we allot for public comment. We are, I'd say, about halfway through our work, and we expect to have a report issued in January. The findings we plan on having start with work that the Attorney General's office is going to do, because we don't believe in having task force just to figure out what to suggest other people do. We're taking responsibility on our own shoulders first, but we will have some legislative proposals, and we will have some administrative proposals and other community proposals that might not involve government at all. But we look at this as a multi-pronged problem. But Madam Chair, insulin is without a doubt a recurring theme of our task force because of the tremendous urgency. A number of people, due to rationing, due to the high cost, have lost their lives. So this does occupy much of our attention and thought. As a people's lawyer, which I consider myself to be, I've heard from people in every corner of Minnesota that we are just having trouble affording our lives. And the cost of prescription drugs is a major factor in that. They're all united in one simple idea. They're entitled to afford their lives, and drug prices are just too high. To address this problem, I formed a task force for lowering the cost of pharmaceutical drugs. I have charged the task force with gathering in the best thinking in order to understand why the prices of prescription drugs are so high and in some cases unconscionably high, and come up with multi-pronged strategies to lower prices. These will include legislative, legal, regulatory, and community-based strategies. I already told you a little bit about the makeup of our task force. I hope you'll indulge me just to mention the names of some of our participants. Our co-chairs are Nicole Holt-Smith, who lost her son due to having to ration prescription drug insulin. But also our co-chair is Senator Scott Jensen, who's a physician, but also Senate District 47. Sherlyn LaChapelle is a nurse consultant. She's also the president of the Black Nurses Association. Dr. Leonard Snellman, general pediatrician, Health Partners. Christy Kewen, she's a patient advocate. Rose Roach, executive director of the Minnesota Nurses Association. Dr. Stephen Schondelmeyer, he's the director and professor of Prime Institute, University of Minnesota, foremost expert on prescription drug prices in pharmacy. Elo Alston, who's a patient advocate. He comes to our meetings in a wheelchair, and coming up with the proper outcome is directly and personally important to him. Nazia Iftikhari, founder and CEO of Health Ease. Fu Hewen, pharmacy manager at North Point Medical Clinic. Jessica Braun, nurse practitioner. Dr. Cody Weiberg, executive director of the Minnesota Board of Pharmacy, who's here today. And Senator Matt Little, Senate District 58. Representative John Lesh, House District 66B. And Representative Rod Hamilton, House District 22B. We have had four full task force meetings thus far, including one just yesterday, and we have 4 scheduled meetings remaining. Public testimony has been taken at each task force meeting. Our work will be completed and a report will be issued by January. We've also had listening sessions in addition to task force meetings. One of them was in Worthington, another in Chaska, and dozens of Minnesotans have attended these listening sessions and provided critical input. The task force is also broken down into smaller working groups, and those working groups have met outside the full task force meetings. The area of the working groups and the focus and topics have been Legislative Regulatory Action Group, and their task is to determine the role of federal and state legislative and regulatory actions in lowering drug prices. The second working group is Causes and Contributors. Their task is to identify the root causes and contributing factors to the increase in pharmaceutical drug prices. Number 3, past, current, and future strategies to conduct a comprehensive analysis of various strategies that have been and could be undertaken to lower drug prices. And so those are our subgroups. In the course of our work, Madam Chair, we've had the opportunity to listen to a lot of people. Allow me to just share with you very quickly that in Chaska, a young woman named Chelsea talked about her 8-year-old son was diagnosed with type 1 diabetes at 18 months. She got involved with the local organization for juvenile diabetes research and went to D.C. as a parent advocate, attended a luncheon sponsored by the drug company, and later found out that there was a lawsuit against them for using patients to make generic drugs unavailable. Michelle shared that her son is a type 1 diabetic, and when he was diagnosed in 2009, a vial cost $35. The same vial today costs $233, and her son goes through one vial every 10 days, so they're paying $700 a month. She was diagnosed with breast cancer and paid $900 to $1,800 per treatment in her cocktail. One drug cost $2,500 for a 30-day supply. One cancer drug affected her pancreas, and she now has diabetes. We're looking at a number of recommendations. We don't have them yet. That's what we're actually doing, is developing the recommendations. But I think I can tell you preliminarily, a number of things we're considering are focusing on recommendations such as these. Minnesota should know what it spends on prescription drug prices. The committee has talked a lot about transparency, making sure that the story gets out, that people know what they're buying. And I would say that sometimes in this body and all over the country, we debate free market versus government intervention. But I've never met any free market advocate who thinks it's okay to have opaque markets. One fundamental basis of any market structure working properly is information, and that is something that I think we all can agree on. Number 2, Minnesota should act as a prudent purchaser of prescription drugs. That is a recommendation that has been made and the committee has discussed. Minnesota should facilitate new, more affordable channels for prescription drug purchasing, examples involving an insulin, EpiPen, naloxone, and Minnesota should encourage and facilitate drug price transparency. Minnesota should prohibit perverse economic behaviors related to prescription drugs, such as identifying market behaviors that lead to perverse economic consequences that may mislead Minnesota consumers. I can assure you that this is something that the Attorney General's office is looking at, independent from our working group. And let me just wrap up, because I know a lot of people are waiting to talk. Minnesota should identify and address price gouging related to prescription drugs. Minnesota should establish a process for assuring affordability and accountability of prescription drugs. Minnesota should provide oversight of PBMs and their market behavior. Minnesota should assure patient access to pharmacist services for effective medication use. Minnesota should support research on prescription drug prices and drug benefits. Let me just wrap up by telling you this. My office is not simply relying on the task force as much as we are proud of it and working carefully with it. In addition to the task force, my office is pursuing legal action right now on pharmaceutical drug prices. As to insulin specifically, Minnesota is currently suing 3 main manufacturers, including Eli Lilly, Sanfoy, and Novo Nordisk, alleging that their list price published was deceptive. The case remains pending, but just this morning, we filed a response to the defendant's motion to dismiss, which we are vigorously opposing. Of course, that is what our mission is. Minnesota is the first state in the country to advance this case, and Kentucky has followed us, and New York is currently investigating. There is a lot of benefit in the multi-state lawsuits we do, and we're hoping to build. So finally, and this is my last comment, Madam Chair, the committee members, again, thank you for having me here today. The work of this task force looks at the costs of all prescription drugs, especially those that Minnesotans rely on to stay alive. Insulin is one of those drugs. Our report will be issued in January, will include recommendations for insulin, but also many other ways to lower drug prices. That said, Minnesotans with diabetes need help now. They're dying now, and it would be prudent for all of us to focus our attention on how we can deliver relief now. So with that, let me again offer my sincere thanks for your attention to this critical issue. It's something we all should, join hands together and figure out how to solve. And I will say that one person who's not on our committee, but who's been at every committee meeting, I just want to recognize Representative Pearman, who has never missed a meeting, and you wouldn't know he's not actually on the task force, but there are certain numerical limits on membership. He doesn't care. He shows up anyway. So I want to say thank you, Representative. That's all I have today.
Well, Attorney General Ellison, thank you very much for that presentation. And I just want to give my appreciation, and I'm sure all of our appreciation, to all the members of the task force, including the ex officio member, I guess, Representative Bierman, for doing that hard work, and really looking forward to seeing what you come up with for us. Because this is a problem that is, I think pretty much every state is wrestling with this problem. This is not just a Minnesota problem. But here in Minnesota, we have a lot of creativity, a lot of good minds, and a lot of ability to form partnerships and find solutions. So thank you very much for helping lead that effort.
Thank you, Madam Chair. And I'll just add, Madam Chair, that our country hasn't really taken antitrust litigation seriously in the last 40 years. It's a bipartisan failure, in my opinion. But, there was a time in this country where we used the Sherman Act, the Clayton Act, to bust up trusts and make sure we had competitive markets and innovation.
That's right.
And my office is returning to really take antitrust enforcement seriously, which I believe will lead to more diversity in product and lower prices. So with that, if there's nothing else, I'm here to stand for questions, but other than that,
Thank you very much.
Thank you, ma'am.
We really appreciate it.
And thank you, members, as well.